Hey everybody, this is Eric with Talking Guns. We had a special story today that really kind of encapsulates a lot of things that Talking Guns is about. We do the guns reviews, we do the gear reviews, we do the coverage of everybody's favorite shows, but one of the things that we also have a huge love and a deep respect for here is veterans. The sacrifice that they've made, the wonderful things that they've done so that we can live our life the way that we feel entitled to based on those freedoms that we enjoy. One of those gentlemen that we were liking to speak about today to cover and bring light to a situation that's very unfortunate is a gentleman named Wes Doss. Wes Doss, I'm just going to read a small bio here and a very long series of events that have transpired that are absolutely unacceptable in every way, shape, and form. So a little bit about Wes here. Wes is an internationally recognized firearms, tactics, and use of force instructor with over 30 years of military and civilian criminal justice experience, as well as a significant operational time in both military and law enforcement, tactical operations, and protective service organizations. Wes holds specialized instructor certifications in the U.S. Army, the U.S. Marine Corps, Arizona Post, the Smith & Wesson Academy, the Sig Sauer Academy, NRA Lead, FEMA, and the Department of State. Wes has studied adult education and human performance extensively and has had a broad background in the martial arts, with over 25 years of training, teaching, and competition experience. Wes is the founder, president, and general operating manager of Kyber Interactive Associates, LLC, and the 1 Inch to 100 Yards Warrior Conference. Wes holds a master's degree in criminal justice administration and an upper-level doctorate in psychology, with an emphasis on sports and performance psychology. Wes is also a member of a number of professional associations, including the International Association of Law Enforcement Firearms Instructors, the National Rifle Association, the National Tactical Officers Association, the Military Police Regimental Association, the International Law Enforcement Educators and Trainers Association, and the International Association for Counterterrorism and Security Professionals. So as you can tell, this gentleman has literally dedicated his life in service to others. And this is what makes this absolutely unfortunate, is he is not being given the same level of respect and dedication that he has given to everybody. So, these events start 3/28 of 2020. On 3/28/2020, at 1826 hours, firefighters and paramedics were dispatched to Wes's house due to Wes's wife calling 911 for Wes, who mentioned that he felt that he was having a stroke. Approximately 20 minutes later, the patient arrived at Valley View Medical Center in Fort Mojave, Arizona. He underwent an admission triage and was diagnosed with non-traumatic intracerebral hemorrhaging and was going to be airlifted to Sunrise Medical Center. The patient was oriented X4 and was able to converse with ER staff and respond to questions and provide the Valley View Medical Center ER doctors, nurses, and staff to take his own information. While at Valley View, he had a CT scan completed, and that's where they found a 4.4 centimeter bleed in the right side of his head. The Valley View Medical Center put him on stroke case protocol fall risk. He was confined to his ER bed, and the bed was lowered all the way down, both side rails were up, and a fall risk wristband was placed on him, and an ER staff member was placed into his room to provide continuous monitoring of him. He was identified by the Valley View Medical Center ER staff upon their workup that as having a droop to the left side of his face, a noticeable muscular weakness on his left side, with an apparent motor deficit also on his left side. The patient was placed on an IV as part of the initial Valley View Medical Center stroke case triage protocol. Valley View Medical Center identified the need in transferring patients to a higher level stroke center for definitive care. The definitive stroke case care unit in the Southern Nevada region is Sunrise Hospital in Las Vegas. The patient was triaged by Dr. William Macklin, who requested a higher level of care from Sunrise as they are a higher level and accredited stroke trauma center, as well as the need for a full neurological stroke workup by a neurologist. Sunrise Medical Center was made aware of the patient's status and the pending air ambulance transfer by Valley View Medical Center attending staff at 7:08 p.m. They were also made aware that the patient's full triage and workup records would be accompanying him. A woman named Sharon and a Dr. Hansen accepted the air ambulance transfer. Transfer documents were prepared and sent with the air flight crew to provide to Sunrise Hospital upon the arrival of Wes. These documents were complete, to include all the ER notes and all additional physical and radiology workups performed by Valley View Medical Center. When Wes left Valley View Medical Center, he was still oriented X4, conversing with staff and alert and aware of his condition and what was happening to him, and his fall risk status was still in place throughout the transfer. The air ambulance accepted Wes, and he left the Valley View Medical Center at around 8 p.m. Wes's oldest daughter made a phone call to the American Red Cross at around 8:20 to get assistance to bring her sister back to Arizona from Georgia due to her being active duty Air Force. Wes arrived at 8:39 at Sunrise Hospital via air ambulance helicopter. He was accepted into the ER and triaged at 8:51. The patient triage was done by Jessica Haynes, RN, and not the stroke case triage team of doctors, nurses, and associated stroke case trained triage support staff. Jessica Haynes, RN, was not a doctor, neurologist, or a trained member of the Sunrise Stroke Case Triage trained team, and that she determined that Wes was not a fall risk. And this was all despite the fact that Wes was previously identified as a fall risk by the attending ER doctor at the Valley View Medical Center. Again, Wes was already been triaged and was identified by Valley View Hospital as a fall risk, and he was still wearing his fall risk wristband. And this is all very important to be noted. Wes was determined as not being a fall risk, was also made without any documented record of being seen by the Sunrise Hospital Stroke Case Trauma or Triage Team doctor or any ER doctor. This lack of the Stroke Case Triage Team doctors or even an ER doctor apparently eliminated the patient the afforded direct physical critical assessment of the patient by a doctor. This was within the stroke triage protocol for this patient and was within the critical first 2 hours of the stroke symptom onset. The lack of a proper stroke case triage denied Wes to the ordering of any new laboratory tests, radiological imaging, neurological exam, or physical examination to assess any changes in the patient's intracranial bleeding and to establish a new treatment baseline or protocol for any patient care going forward at Sunrise Hospital, as this was the next level of care for the stroke case patients. This determination by Jessica Haynes, RN, as not being a fall risk was done despite Wes having a previously diagnosed and documented loss of feeling on his left side of his body, a documented loss and reduction of motor function level and muscular stability at the Valley View Medical Center. When he was accepted at Sunrise Hospital, his Valley View Medical Center fall risk wristband was still on his wrist. Despite an approximate full hour and a half alert on the patient's arrival and ambulance transfer with a stroke diagnosis, it appears, by a lack of documentation, that Sunrise Hospital emergency room never initiated the stroke case alert for their stroke case triage team and the alert of the Sunrise Hospital's multidisciplinary stroke code team to potentially assist as required or necessary. Upon arrival, there was no apparent documentation in Wes's ER intake record that he was ever assessed by a member of the Sunrise Hospital stroke case triage team. Moreover, it is unclear whether the stroke case triage team was ever alerted or even standing by on the patient's arrival. After Wes's arrival, it was noted in his record by Jessica Haynes, RN, that the patient was at no risk for a fall. The neurosurgeon, Dr. Seif, was informed of the patient's condition, at which point he noted there is no emergent surgical intervention needed. It remains undetermined whether or not Dr. Seif was physically present to conduct a doctor-patient assessment of Wes to make this determination. Wes does not appear to have a new baseline stroke case clinical workup, CT scans, laboratory workups, or medication review or workup upon his arrival to determine a new patient care baseline of stroke or intracranial bleeding. Wes notified the Sunrise ER staff that he had to urinate. This would be fully expected as he was placed on an IV as part of the Valley View Hospital initial ER stroke case triage protocol several hours earlier. At this point, the patient had been in the Sunrise ER for approximately an hour and a half. It appears that Wes was presented with a urinal to urinate in by the ER staff. It is not documented which staff member presented the patient with the urinal. Wes was for some unknown reason allowed by the ER staff to sit up in the bed and with the side rails on his bed and then was allowed to, as stated by Wes's wife and daughter, dangle his legs and feet off the side of the bed. Wes fell out of his bed while trying to urinate. He had asked if he could use the restroom instead of urinating on himself. The ER staff allowed Wes to attempt to do this despite the previously well-documented physical deficit on his left side. The attending female ER nurse apparently did not attempt to physically assist Wes due to him being physically bigger than her. It is not documented whether or not she attempted to call for help to assist or move Wes despite knowing that he was a stroke patient. Wes only demonstrated the capability to use only his right hand and hold the urinal and attempt to balance or stabilize himself and hold the urinal at the same time. Wes fell to the floor, apparently from a standing position while unattended by the ER staff, striking the left side of his head with enough force to create a softball-sized hematoma. The fall was significantly hard enough to develop a well-defined swelling of his ear, as defined by a visible purple coloring of the skin, which ended in a trauma-induced blunt force splitting of the skin, which ended up causing blood to cover his face, neck, and down his back and his chest. When Wes's wife and daughter arrived at Sunrise Hospital, they found that Wes was in this state, laying on his hospital bed, unconscious, intubated, in a neck brace, bleeding from his ear with a visibly large hematoma on the left side of his head. Wes's wife and daughter, upon the arrival of the ER, after seeing Wes in this condition, asked what happened to Wes's head, ear, and neck. They were not able to get a straight answer from any one of the nurses in the room. The answers were unclear and in some cases conflicting from nurse to nurse as to what happened to Wes's head. No ER doctor was present or made themselves available to answer any of the family's questions as to Wes's physical current condition. Wes's attending nurse, Julie, which no last name was given, came in and finally explained to Wes's wife and daughter that Wes was too big for her to assist. She admitted she did not get or attempt to get another ER staff member to assist her with Wes, and in doing so apparently allowed Wes to fall during her attempt to assist him. This fall allowed the patient to fall full force onto the floor, striking his head and incurring more injuries. After a round of intense questioning by Wes's wife and daughter, it was disclosed by the ER staff to Wes's family members that the fall induced a secondary stroke, and which in turn increased bleeding and caused a midline shift of his brain. Wes, after the fall, was not immediately reevaluated by the Sunrise Stroke Case Triage Team, nor an ER doctor, nor did he receive a CAT scan until approximately 10:10 p.m. This is a full 2 hours after his arrival at the ER, and was apparently only ordered due to a fall that he suffered while in the ER. The records show that after the fall, Wes's care was turned over to Dr. Maria Lurasesi Monhata. The records show that this doctor reported that there was no time-sensitive tests needed or ordered. It appears that the Dr. Maria was covering for a Dr. Christopher Navarez. Records indicate that Wes was labeled a fall risk only after he had already fallen and was injured, suffering the second stroke, was intubated, placed into a neck brace, and rendered unconscious with a massive secondary internal cranial bleed that was shifting his midline of his brain. Wes was intubated and unconscious by 10:44, and even after he had an identified secondary bleeding on his brain, Wes was not triaged or deemed critical and positioned for emergency surgery to relieve the pressure on his brain, or do any surgical intervention to stop the bleeding on his brain until basically 30 minutes after midnight the next day, 3/29 of 2020. Charge nurse Quinta came up to tell Wes and his daughter while they were in the operating waiting room. She mentioned that it was their mistake for not reading the chart on the patient, and that she educated the nurses for the next time they received a stroke patient in the ER. Wes's daughter inquired about the fall risk and why it was not placed or labeled as such at the time of his admittance, especially when he was already on a fall risk status from the Valley View Hospital, at which point Nurse Quinta stated to her that I did label him after the fall. At this point, the damage had already been done. Wes had already received another head trauma. He had already had another stroke caused by the trauma and the bleeding in his brain. As we can tell, this is a seriously disturbing timeline here. And I understand that it's hard to read. It's hard to hear. It's hard to read. This man who dedicated his life and service to other people was being given absolutely abysmal treatment here. So moving on to the next day, neurosurgeon Dr. Seif came out roughly at 1:30 in the morning to let Wes's wife and daughter know that he had survived the surgery and he is going to be admitted to the neuro ICU. Dr. C further stated to Wes's wife and daughter that if the surgery went wrong, we would be having a totally different conversation. Wes's wife and daughter left Sunrise Hospital and Las Vegas at roughly 2:30 in the morning. During the family's trip back to Bullhead City, they called to inquire about the stability of Wes. The ICU staff stated that he was told that he was fine and sleeping. Wes's daughter called again at roughly 3:45 to 4 o'clock in the morning to inquire how Wes was doing, only to be told by the ICU charge nurse, Heather, to stop calling because she was bothering them. At roughly 8:30 in the morning, the oldest daughter received a call from the American Red Cross and was informed that Sunrise Hospital representative they had contacted stated that it was not necessary for Wes's youngest daughter, who was an active duty service member, to be here because it was not life or death situation. This was at the same time when Wes had just had major brain surgery, was in the ICU, on life support, and in a coma. You guys, I don't know what else would qualify as life-threatening injury, if not that. Victoria had to get clearance from a 3-star general to come back out to see her father, Wes. Wes was scheduled for a CT scan later in the morning to see if the surgery had relieved the swelling of his brain and if there was any other immediate need for additional medical intervention. At roughly 3 in the afternoon, Wes's daughter was called by the neurosurgeon Dr. Seif, who stated that the CT scan came back and that Wes had an additional increased swelling around his brain and there was one last surgery that he could do. In a bullet point here, he mentioned that the surgery was dangerous and many individuals do not survive due to the brain being exposed. Wes's wife and daughter agreed to allow Dr. Seif to perform the surgery in an attempt to save Wes's life. Wes was taken back to surgery at 10:30 p.m. 7 hours had passed after the fall, and there was no stroke case triage that was performed to properly assess the patient's condition, and no surgery done directly after the injury to relieve the pressure that was building up around his skull. The following day, March 30th, 2020, Wes's daughter had placed several phone calls to the hospital to check on Wes's condition after the surgery. They state that he is stable and there is no change to his status at the time. At no point did the doctor, the ICU charge nurse, or the hospital case manager ever call the family after the surgery to inform them how the surgery went, how Wes was doing, or what Wes's condition was. Wes's family tried to contact Sunrise Hospital patient advocate and discuss the lack of responsiveness, courtesy, and compassion, only to be informed by the hospital telephone operator that the hospital didn't have a patient's advocate. Wes's family then discovered from the operator that this position had been vacant for several months. Wes's family asked the hospital operator if there was anyone they could speak to that was filling in for the position as an interim patient advocate. They were told that no one had been appointed to fill in for that position and just to call the number and leave a voicemail on the answering machine and that somebody would leave a message. Wes's wife submitted a request for Wes's records. They did this because they felt that the answers they were receiving and the general attitude towards them, that they wanted to ensure that the integrity of the records contents were preserved and that they would not be lost or altered. March 31st, 2020, a Dr. Lee was assigned as Wes's new attending doctor for the week. She provided a FaceTime call so that Wes's wife and daughters could see Wes and stated that this was being done in this manner due to COVID-19 concerns. After Wes's family had seen the patient, Dr. Lee pressed the family and insisted that they sign a DNR in case Wes went into cardiac arrest at some point during his ICU stay. Dr. Lee reviewed Wes's CT scans from 2 days prior and kept going and discussing the swelling with the family, but at no point did Dr. Lee ever order any new CT scans to see if the swelling on his brain had changed over the 2 days after surgery, despite the family's questioning about his current health status. Dr. Lee again stated to the family that the next 48 hours were critical. The family again asked about whether or not the surgery had relieved the pressure on Wes's brain, and if any new CAT scans had been ordered or taken to determine Wes's current status. They did not receive an answer from Dr. Lee on an order for the new CAT scan, or if she had ordered on to perform a current medical diagnosis or assessment to evaluate whether or not further medical intervention was necessary. Instead, Dr. Lee pressed the family that they should determine whether or not we should withdraw care and just allow Wes to die. I don't know about you guys, but if that was the response that I got from a doctor that was taking care of one of my family members, there would be no more conversation. The only conversation there would be with a lawyer. Moving on, the next day, April 1st, 2020, Wes's wife and daughter were finally allowed to visit Wes in person. Dr. Lee came into the room during the family's visitation, and the family immediately pressed Dr. Lee as to what they were doing to care for Wes. Wes's wife asked why there had been no new CAT scans done and requested that Dr. Lee order a new CAT scan to be performed and that an EEG be done and performed. Dr. Lee again insisted that the family sign a DNR if they were going to complete a CAT scan because Dr. Lee feared that Wes would go into cardiac arrest during the scan. Wes's wife explained that Wes was in excellent physical condition and had never had any cardiac issues. She noted to the doctor that his vitals had been stable this entire time from his hospitalization, and that she felt as though there were no need for a DNR form to be signed. So the family had addressed this with this doctor already, explaining that they did not want to sign a DNR. Dr. Lee stated that there could be a fluid leaking from the patient's brain, and his brain could still be swelling. Wes's wife inquired as to how Dr. Lee could make a precise medical diagnosis of Wes's condition over the past 3 days, as the most current CAT scan was done prior to the surgery and no post-surgical scan had been done. Wes's family declined Dr. Lee's request for the signing of the DNR and again immediately requested that a new CAT scan be ordered and performed. A caseworker by the name of Nanette came into the room and stated to the family that Wes was ready to be moved to a nursing home. This was done only just over 48 hours after the patient had undergone 2 major brain surgeries and was still in the Sunrise ICU unit. There was no previous interface or scheduled meeting between the case manager's office and or Wes's family as to the status of Wes. So my question being, if they're pushing a DNR so hard on the family, why are they even considering transferring somebody to a nursing home? That doesn't make a whole lot of sense to me. If they're worried about being able to move him enough to do a CAT scan on him, in what universe are they even considering moving him to a less equipped facility? That doesn't make any sense to me. Wes's daughter took the case manager aside and spoke with her and stated the family was not ready to discuss a DNR at the time, and Nanette said she understood and left. The family stated to Dr. Lee that moving him across town would increase stress compared to taking him downstairs to complete a CAT scan, which is exactly what I just wondered. Dr. Lee did order the scan, and Wes did not have any complications during the procedure. During this visit, Wes's family observed and documented by video that Wes was breathing above his respirator assistance, moving his toes, head, and shoulders, and when his wife kissed his face and wiped his face down, he moved his arm and his face. Wes also wiggled his toes each time when his wife told him that she loved him. April 2nd of 2020, Wes's daughter called the ICU facility, and Dr. Lee went over the CT scan. Dr. Lee told Wes's daughter that the patient had no leaking on the brain and that there was no new swelling, but his condition still remained the same. April 3rd, Wes's wife requested his daughter that the ICU facility to call the ICU facility and inquire on Wes's condition, as they had no input from any staff there for over 24 hours. This is despite the fact that Wes's family requested to speak to Dr. Lee daily on Wes's condition. Wes's daughter called the facility and spoke to Dr. Lee, who informed her that Wes had developed a fever. Wes's wife requested a second opinion be done on the patient because he had defied the odds and that they had stated for us to expect and continually noted that he would not survive the first 48 hours. After prolonged assistance by Dr. Lee and the hospital staff, the family signed a DNR request and for Wes's family to discontinue their life support care for Wes. Dr. DeAndrea reviewed the case, but appeared to have only reviewed the information already presented to him from Dr. Lee. He did not order or perform any new neurological tests, diagnostic exams, radiology exams, or laboratory workups. Wes's daughter again called the hospital administration office to figure out if they had appointed or assigned a new patient advocate, and they were informed by administration that there was no patient advocate available for the hospital, but that they could transfer them to the director of records. Wes's daughter spoke with Fran, the director of records, and inquired if she would release the records within the 30-day time frame. She stated, "No, we have policies set in place that allow us to give out records when the doctors are done." Wes's daughter then asked if they abided by HIPAA and the 30 days to release records once requested. Fran then became defensive and very aggressive with her and stated, "I am not going to play hypotheticals with you." Fran also refused to release records to Wes's wife, stating the patient would need to sign for them. A man in a medically induced coma after 2 brain surgeries. They are demanding that he sign his release for his records when his wife, his spouse, who has power of attorney over his medical well-being, was making requests for the records. That doesn't make a lot of sense to me either. Wes's daughter explained to the director of records that Wes was in a coma and there would be no way for him to sign the records, and that when the circumstance was right, so the records went to the next of kin, which would be Wes's wife. Fran still refused to release the records and fell back on her original statement she had made before that she was not playing hypotheticals. On April 4th, Wes's daughter spoke to Dr. Lee regarding Wes's condition. She had continued concerns regarding the patient's fevers because this could lead to infection and further complications for Wes. Dr. Lee attempted to pass any of the family's concerns regarding the fever and continued to be speculative and negative on the family's observations as to Wes's movements and response to external stimuli. She expressed no interest in looking at the videos that the family had taken of these reactions and responses. Dr. Lee is now stating to the family that Wes does not react to any stimuli and continues to disregard the family's observations and inputs. On the 5th of April, Wes's daughter spoke to Dr. Lee regarding Wes's condition, and again she continues to be negative. Dr. Lee stated to the daughter that she does not have any hope that he will come out of this comatose state. Wes's daughter stated to Dr. Lee that she felt the hospital was not treating the family with compassion, respect, and any level of kindness under trying times, to which Dr. Lee did not respond, ending their phone correspondence. On April 6th, at 9:51 in the morning, Wes's daughter received a call from Dr. Lee. Dr. Lee was very verbally aggressive with his daughter over the phone. She immediately accused the daughter of calling her early in the morning when the daughter was at work. She then openly threatened the daughter, stating to her, "You have 24 hours to figure out what you are doing with your dad. You either withdraw care, or I will trick and peg him and ship him off to a nursing home." Wes's daughter inquired if this was going to happen today, and Dr. Lee replied, "Yes, I can do this now." At roughly 1 o'clock in the afternoon, Wes's daughter received a phone call from Chief Medical Director Robert Smith and the Director of Quality Management. During this call, Wes's daughter explained to Robert Smith the issues the family had and was continuing to be faced with by the hospital staff. Wes's daughter then inquired if this is how they did business with their physicians, threatening family members to openly perform surgery without their consent on their loved ones, and then to pull the plug again without the family's consent. Mr. Smith stated that this was not the family's case and that he was not aware of it. He inquired if there was anything that he could do in the meantime. Wes's daughter stated to him, "Promise not to remove my dad from the ventilator," to which he agreed. Wes's daughter then spoke to the Director of Quality Management and inquired if they did not abide by HIPAA law because it was a civil rights issue if they continued to be refused the records that they had requested to be given to Wes's wife. The director stated that this was not the case and that it was the daughter's misunderstanding of the rights of the next of kins and that the records was not correct. She stated that she would get the records released to the family immediately, however. Robert Smith stated that he would like to have a phone conference call so that everyone could be on the same page in Wes's case. He stated that he would have the Director of Case Management reach out to set up a phone call for the following day. Wes's daughter asked that Mr. Smith would ensure that all associated hospital staff members working directly on Wes's case, an example, doctors, nurses, case managers, administrative staff, and Mr. Smith be present on the phone call, and he agreed. At roughly 4:30, Wes's daughter received a phone call from a woman named Lisa who asked if she was free to take the call in 15 minutes. Wes's daughter told her she couldn't, that she had to work, and that her mother and younger sister were not available to be on the call either. Wes's daughter noted that she and Mr. Smith had agreed that the phone call was to be scheduled for the following day at 1 o'clock so that all parties may be present and involved in the discussion. April 7th, 2020, 1 o'clock. The conference call took place on time. The hospital staff introduced themselves, however, Dr. Lee was not on the call. Mr. Smith said that she had taken a 7-day break and would not be available for the call. Wes's daughter stated that this was not what was agreed on by Mr. Smith when the conference call was set up. Wes's daughter also noted that Mr. Smith had agreed to have all of the staff present so that the family could have their questions answered in a clear and transparent manner by the patient, Wes's healthcare staff. From the beginning of the call, it was apparent that the hospital staff was unprepared. Mr. Smith had not briefed the staff on the context for the call, and most of the staff were totally unprepared and unable to answer specific questions regarding Wes's care. Mr. Smith and a Dr. Majik didn't even have Wes's medical records in front of them to look up any of the care timelines or the procedures for Wes's family. Dr. Majik became at several points in the call verbally loud and defensive when asked specific questions by shouting at them over the phone. Robert Smith had no idea on any of the questions asked by the family, and on most of the questions didn't even have the patient's medical records in front of him to refer to even the simplest of questions. This even included the time of Wes's admission to Sunrise Hospital. The director of case management attempted to stop the calls twice by stating, "My doctor is not prepared to answer these questions." Some of the family's questions were related to the following. When was Sunrise Hospital notified of Wes's projected arrival? Fairly easy question that should be able to be had fairly quickly. Why was Wes not triaged by any member of the stroke case team, which was the original reason why he was there in the first place, was to go to a more capable team than he was with before at a regional hospital that was renowned for their stroke care? Was the stroke case triage team ever notified that Wes was being airlifted to Sunrise? Why was Wes not kept on a fall risk protocol when he was identified and airlifted as a stroke patient and under an active fall risk protocol from the previous hospital when he arrived? Why was Wes's family being stopped from obtaining Wes's records by the records department for over 5 days? Why was Wes, who had a documented muscular and motor deficit, allowed to sit on the edge of his bed and left unattended and unassisted by any of the ER staff? And why was Wes not triaged by Sunrise Hospital to establish Wes's stroke protocol baseline and to establish Wes's care plan? I feel like those are some very reasonable questions that should be very easy to answer, but apparently they did not have answers for those. At one point during the call, Dr. Majik admitted that Wes was not triaged upon arrival at the Sunrise ER. During the phone conversation, Dr. Majik admitted that Dr. Seif, the neurosurgeon, had already deemed Wes as a lost cause on April 29th, 2020, when he had had his second surgery, and this is why they didn't rush to get the surgical procedure started. Wow. April 8th, 2020, Lisa, the director of case management, called Wes's daughter stating that she would get the medical records for Wes today via email. When 3 hours had gone by, when the records had not arrived, Wes's daughter called to check on where the records were at in the process. Wes's daughter was notified by a member of the records department that the family would not receive the medical records because it was a process that was automated, so it could take 2 to 3 business days per the hospital's policy. Wes's daughter informed the staff member that this was unacceptable and not what was agreed to by Mr. Smith and the family. Wes's daughter asked for Dr. Robert Smith's information so she could call him to facilitate the records release per the agreement. Wes's daughter was told that they didn't have that information and they would call her back. Wes's daughter let them know that she would wait on hold for them to get the chief medical director's contact information. Wes's daughter emailed Dr. Smith, who ended up calling her back, stating, "It's sometimes difficult to download all the medical records with the firewalls attached for safety." He continued on stating, he is new to the hospital, being there for 1 year, stating Nevada lacks good health care. Mr. Smith further stated he understood they failed her father and that they would use his fall as an example to educate staff. Wes's daughter stated to Mr. Smith that my father shouldn't be an example, he should have been taken care of properly at the point of his arrival for care. After the phone conversation with Mr. Smith, Lisa from Sunrise called Wes's daughter stating the records were being FedExed to her. Lisa stated that the family would have the records on Friday. Lisa then asked Wes's daughter if she would go ahead and set up a follow-on call to let her know that the agreement from the last phone conference call was that the family would have a chance to review after they received all the records for Wes, and without those records, she would not be able to schedule this call. Lisa then became abrupt and rude, with Wes's daughter stating, "Fine, I will just call you back on Monday." It bears to note that Lisa was on the conference call and was fully aware of this conversation and the agreement that was made between all parties on the issue. So she had already been on the conference call and she knew what the situation was. She was just not going to facilitate it. April 9th, 2020, Wes's daughter emailed Mr. Smith about visitation for Wes's wife and Wes's daughter to visit with Wes. Mr. Smith stated that he would coordinate it so that Wes's wife and daughter could go see Wes. Both family members were allowed to visit Wes. Wes's wife took the opportunity to attend to Wes. She washed and shaved him, applied skin lotion to his body, and generally attended and talked to him. April 10th, 2020, Wes's wife and daughter went to visit Wes for the second day in a row. Wes's wife noticed a rash covering Wes's body, which was not there the day before. Wes's wife inquired about this condition with a doctor, who then asked the wife if the patient was allergic to anything. If Wes had been properly triaged in the ER and a full and comprehensive records transferred by the Sunrise Care staff, they would have seen that Wes was identified as not having any known allergies. Dr. Majik or any of the other attending ICU nursing staff or the attending care staff had never once called the family to verify if Wes was allergic to any food or medication. When Wes's wife entered the patient's room, she noticed a dirty towel in a container of dirty water near the patient's bedside. Wes's wife notified the care staff of this. Wes's wife was also made aware by the doctor that Wes had not been getting any sort of nutrition for the past 2 weeks. 2 weeks. Wes's family questioned the doctor why they had not been informed that Wes wasn't receiving the necessary nutrients for the 2 weeks of his care stay at Sunrise and why the hospital failed to report this to us. Wes's daughter emailed Mr. Smith about these concerns. His response was one of a level to attempt to pacify her. His response was, hopefully, they'll be able to do something about it. She also brought up the concern about the dirty linens to have it not addressed. On April 10th, the medical records finally arrived to Wes's wife's house. Wes's wife has given her written consent to the doctor to schedule the surgery for the following day to insert a feeding tube and a tracheotomy tube so the patient could be administered the appropriate calories and nutrients and respiratory therapy needed to sustain Wes's care. April 11, 2020, Wes's wife reached out to the hospital because Wes was scheduled for surgery to insert a feeding tube and a tracheotomy tube for the afternoon. Wes was taken back around 2 to 2:30, and the hospital did not have the common courtesy to call and inform Wes's wife that he was taken down for the surgery. Wes's wife waited for hours before she called the ICU nursing station at about 5:30 in the evening to inquire the status of her husband, at which point the charge nurse became aggressive and rude to her for calling and inquiring about her husband. Wes's wife did not receive a call from the doctor or the ICU nursing staff as to when her husband was out of the surgery or to discuss Wes's condition and how the surgery procedure went, or if he was even stable. The next day, April 12, 2020, Wes's wife and daughter went to visit Wes and see how the surgery had gone, because they weren't able to get any information the previous day. Wes's wife noticed that Wes was not attached any longer to the ventilator and appeared to be doing well. Wes's wife stated that Wes was finally getting the appropriate nutrition and that his color had improved. Wes's wife had no interaction with any of the doctors on staff to discuss how her husband had fared during the surgery and what to expect for Wes's immediate and long-term care. April 13th, Wes's wife visited Wes to only find him laying in a urine-soaked bed. She went and got the ICU nurse to attend to her husband to discover that Wes's catheter was not placed correctly. When Wes's wife confronted the nursing staff, she was immediately told by the charge nurse, Annette, "What do you want me to do about it? This always happens." When Wes's wife asked the other nurse, Jennifer, if she could smell urine, she stated, "No, I can't smell urine." The nursing staff cleaned Wes up and got rid of the urine-soaked pads and sheets. Wes's wife continued to clean up Wes because she feared the nursing staff did not do a good job cleaning her husband. During the cleaning of her husband, she discovered that Wes also had feces that had not been cleaned off of Wes. Wes's wife documented this unsanitary and patient safety concern and proceeded to clean the feces off of her husband. This incident further led Wes's wife to worry that the proper level of attention to her husband was placing him in an unsafe and unsanitary circumstance. This finding raised Wes's wife's level of concern and stressed the potential that her husband was being neglected and placed him at a higher risk of infection. Wes's wife also noticed that the rash on Wes was still present and appeared to have gotten worse on his chest. Wes's wife confronted Dr. Magic about this rash, and the doctor appeared to be more understanding and stated that she was going to give him Benadryl to reduce the rash. The statement was a bit of confusion because 24 hours had passed from when the doctor was first notified of the rash, and she was just now going to give him Benadryl for his condition. The nurse Jennifer finally began to show some compassion when she found out that Wes trained law enforcement officers and military because her son was a Metro police officer. You guys, we're getting there. We're getting there. This is still not quite the end, so bear with me. Wes's wife and daughter went to visit Wes again on April 14th. The youngest daughter had stated that she saw Wes's left eyelid partially open and that he would mouth to her when she would speak to him. She also noted that when she wasn't speaking to him, his lips were not moving. Family FaceTimed so that Wes's oldest daughter could say hi to Wes, and this was visible that he was moving his mouth when the family member started speaking to him. Wes's family noticed and documented that Wes continued to wiggle his toes and was moving his head and shoulders. Wes's family identified and documented that Wes was off of the ventilator completely and breathing on his own. Wes's wife spoke to the respiratory therapist who stated that Wes is breathing stronger and stronger on his own every day. Wes's wife was panicked because she wasn't sure what was happening to Wes, and the respiratory therapist reassured her that Wes was coughing on his own. Dr. Majik and Dr. Lee both stated to Wes's wife and family that Wes never coughs on his own and does not have the ability to cough, so getting conflicting information from two different people. Wes's respiratory therapist has not only observed, but has also documented the fact that Wes is coughing and breathing on his own stronger and stronger every day. The therapist stated to Wes's wife, and has documented this, that the patient does this on his own without assistance. Nanette, the caseworker, came in and attempted to give Wes's wife forms and brochures for long-term care facilities. Wes's wife informed Nanette that she did not want to speak about this now because of the upcoming conference call, and this was one of the topics agreed to be discussed on this call by all parties involved. Nanette appeared to understand and then left the room. Wes's wife's anxiety was raised to the point that her daughters were in fear for their mother's physical and mental health. Wes's family was beginning to feel like each time they came to visit their father, they were going to be ambushed by the case management staff. Wes's oldest daughter emailed Mr. Smith about their concerns to document the incident, and Mr. Smith said again that he would look into the situation. Wes's family was beginning to feel that Mr. Smith either wasn't addressing the staff or didn't have any control or power to ensure that the family and the patient's interaction with the staff was coordinated. On April 15th, Wes's wife and oldest daughter both received a phone call from a long-term acute facility in Las Vegas. This facility coordinator reported that Lisa, the Sunrise Director of Case Management, had provided the patient's personal health care information to them in hopes of transferring the patient to their facility. This was never discussed with the family, nor did the family provide any permission for the Sunrise Director of Case Management to provide the patient's personal protected information to this or any other long-term care facility. Wes's wife called and left Lisa a voicemail requesting that she please stop doing this until they have the follow-up conference on April 24th of 2020. She also again noted to Lisa that this was one of the agreed points of the discussion. Wes's daughter emailed Dr. Smith about the recent incident. Mr. Smith again pushed her concerns off by stating, "I'm sure this wasn't Lisa's intention." I feel like that's pretty intentional. Giving information out to a long-term care facility after it was specifically requested not to be done because it was going to be addressed on an upcoming conference call seems pretty clear to me. With all the actions by the hospital staff, Wes's wife called her own doctor to schedule an appointment for herself because of the physical and emotional stress and anguish that this incident was taking on her health, which to me is completely understandable because this is a cluster. April 16th, 2020, Wes's wife received a phone call back from Lisa, who is the director of case management, who told Wes's wife, "I will do whatever I want with your husband's personal health information. I will call all the facilities to let them know about him." When this call was made, the family's youngest daughter was present, And Wes's wife had the telephone on speaker, so the conversation was witnessed and documented. Wes's wife was driving at the time the call came in, and Wes's wife told Lisa that she could not have this conversation now because she was driving on the highway on her way to see her husband. Wes's oldest daughter emailed Mr. Smith about this, who again pushed this concern off by saying, "So who was your mom going to be working with for the discharge planning?" Nobody yet. That was the whole point. Wes's daughter again noted that Mr. Smith that he had agreed that this was one of the topics that was to be discussed on the next conference call. Wes's daughter noted that all of these types of calls were adding to the mental and physical stress that her mother was being subjected to unnecessarily. Wes's daughter noted to Mr. Smith that at no time was there any ever request made by the family for a coordinating meeting to discuss or discharge planning by the case management department or director before the conference call. Wes's wife called Mr. Smith to speak about the continued inappropriate and untimely, aggressive, and uncompassionate behavior that was being displayed towards the family. Mr. Smith never returned her phone call, despite his statement on the last conference call that he was the point of contact for all concerns involving Wes's case. Wes's family has attempted to get Wes into a VA rehab because it is in his earned service rights. Lisa, the director of case management, was asked to speak to the VA caseworker, Kim, to help coordinate this potential care option for the patient. Lisa informed Kim that the patient is a vegetable and he cannot breathe on his own. This statement is not substantiated by the discussions that the family has had with the respiratory therapist and the documented therapy notes by his therapist. Wes's daughter had noted to Mr. Smith in an email that due to Lisa's untrue and non-fact-based statements, that Wes has been denied intake at certain VA healthcare hospitals. Lisa's statements have severely impacted Wes's continued specialized care and recovery process. The respiratory therapist has documented that Wes can breathe on his own. Wes's family has documented this fact on video and through photos. Wes's family has also documented on video that Wes has been wiggling his toes, moved his head and shoulders, and his lips to verbal stimulus. Wes's family has also documented that the patient's eyes follow light. Wes's wife and family have asked the doctors and staff when the next comprehensive post-surgical stroke case patient assessment will be conducted. Wes had been at Sunrise Hospital for over 18 days at this point. He has gone through 2 major brain surgeries and has to date had a follow-up neurological, respiratory, and physical examination, and has to date received those examinations. Wes's family believes that Sunrise Hospital has failed Wes by not delivering the exceptional health care he deserves, with the inclusion, compassion, and respect for the patient or his family. You guys, this is a travesty that somebody who has dedicated his whole life to the service of others would be treated with this level of disrespect. Absolutely, absolutely unacceptable. So, we had one of our editors reach out after receiving this to the family to ask a couple of questions, which is very important moving on. So, our editor got in touch with a family friend, and this is basically how this conversation went down. So, the question was, where is Wes now, and what is his overall condition? The answer is, Wes is still at Sunrise Hospital in Las Vegas, Nevada. His condition is stable and he is improving. He needs to be moved to a better facility to support his long-term care and rehabilitation. Our editor then asked who dropped the ball initially, the hospital that life-flighted him or the receiving hospital, to which was responded Sunrise Hospital in Las Vegas, as evidenced by the events on March 28th of 2020. Our editor then asked, we need you to be sure. Also, did they get documentation that Sunrise notified that he was an incoming stroke case? The answer was yes. Valley View Medical Center in Fort Mojave, Arizona notified Sunrise Hospital in Las Vegas, Nevada that they were transferring Wes to them via air ambulance. They also notified that the patient was an identified stroke patient, that he was being transferred to them for higher level care, also as evidenced by the events on March 28th that we already covered. If they did, why wasn't the triage team present? Sunrise Hospital has yet to answer this question. They do not know this from the admission document that a nurse, not a doctor, not the ER doctor, no one from Sunrise Hospital stroke case triage team saw Wes when he was admitted. To make things worse, when Wes was admitted, he was already placed on the fall risk status by the ER doctor at Valley View Medical Center. The nurse at Sunrise Hospital overrode a doctor's order, not to mention that it was noted in Wes's medical records that he was delivered to Sunrise upon this transfer. He had also had a fall risk wristband on his wrist when he was admitted to Sunrise Hospital, as again evidenced by the notes that were taken on March 28th. Everybody here noted that things weren't really adding up. It seems like either gross negligence or total amateur hour over there, to which the family friend responded, Sunrise Hospital is a complete cluster. He's got another good friend, who is also a good friend of Wes, that can call to confirm this. His name is Mark Christensen. He's a retired Green Beret, certified Veterans Service Officer, and the Executive National Director for Veterans in Politics. He was also paraplegic since 2016 due to a spinal cord injury. He had his own incident at Sunrise Hospital. His number was given to verify and corroborate these things. He has also additional information for us to help fill us in the blanks. Our editor then asked, is there a lawyer involved? Are you sure this approach won't hurt him legally? Before we like to put this out, we'd like to know for sure, just to make sure that Wes is taken care of. To which they responded, the short answer to this is it is in the works. Mark is the person to answer this for you in more detail. He has an attorney that is in touch with the family and is his own attorney. We here don't understand how this could not be a huge malpractice case. When we asked if they thought that this was going to go that way, the answer from the friend was they agree. Mark says that the danger close target at this time is to get this out to the public eye through the media. We're trying to get more donations to Wes's GoFundMe donation site, as the family would need more money going forward to cover those bills, and to provide and to help take up some slack because Wes's business is on hold as he is in serious medical need right now. Our editor noted that based on what we read, we would think that there'd be solid attorneys would probably line up to take this one, and a lawyer obviously would compel these hospitals to cooperate as they were not being helped by the hospital staff in basically any form or fashion. Family friend agreed and said that the attorney that Mark has set the family up with is going to take the case and should have the family under contract by close of business on Friday of the next week. Mark can explain this man's background when you speak to him. We then asked, do you think the respective hospitals are going to conduct impartial internal investigations? To which that person answered, no, they are going to cover their own behinds. That's what hospital administrators do. Right now, they have already started to do this to some degree. This is why I believe that the sooner we get this into the public light, the better. There are other people involved with helping out. Most notably are Debbie Lee, mother of Mark Lee, the first Navy SEAL killed in Iraq. Mark has gotten Colonel Alan West and Senator Martha McSally involved and is working on getting Sean Hannity to review the case as well. We also asked, the first step in this debacle is to find out if the sending hospital notified or received Wes's condition and a pending arrival, just like any other investigation piece by piece with proper documentation or witness accounts. No conjecture. There has to be a paper trail or electronic footprint. Basically finding out, are the ducks in a row? Is this documented as having happened? To which the family friend responded, yes, Valley View did notify Sunrise Hospital of Wes's condition, as well as his identified physical and motor deficits. The air ambulance service was also notified of Wes's condition as well as his identified physical and motor deficits. Moreover, a full copy of Wes's medical records and CT scan was included to Sunrise upon his arrival, as evidence again in the notes of March 28, 2020. You guys, the family has provided us a copy of their timeline of events as clear of emotion as possible for everyone to review prior to going online with this. We read through this. We got as much verification as we could. And we here decided that it was worthy of note for a gentleman whose family was reaching out to help in a time of need, a gentleman who provided service and dedication to this country and everybody's freedoms. You guys, if you can, we'll have a write-up, the timeline posted on talkingguns.net so you guys can further review, at which point we will also get more information for Wes's GoFundMe and set up a list of ways that we can help this family in their time of need. Thank you for your consideration. If you feel the way that we do, we're going to do everything that we can, everything in our power to help this wonderful gentleman and his family in their time of extreme need. You guys, sorry for the hour-long video here. It is a very important thing that needed to be discussed. That being said, this is Eric Wenzel with Talking Guns Media. Thank you.